Order, order. We start with questions. Secretary of State for Health and Social Care. Madam Jogee.
Thank you, Mr. Speaker. Question 1.
Minister, and welcome.
I thank my honourable friend for his continued support for people with Parkinson's, a condition that I know is close to his family. This government inherited long waits for neurology, with only 53.4% of patients, Mr Speaker, including those with Parkinson's disease, waiting less than 18 weeks for a referral to neurology services in June. Our elective reform plan will free up over 1 million appointments each year for those who really need them, including patients with Parkinson's, and NHS England's Getting It Right First Time programme is continuing to work with 27 specialised centres in England, including at university hospitals in the North Midlands.
I'm joking.
Thank you, Mr. Speaker. I thank the Minister for her answer and congratulate her on her appointment. Will she join me in paying tribute to my constituent Julie Hibbs from Vadwell and Newcastle-under-Lyme, who has long campaigned for support for people with Parkinson's like her? Will the Minister meet me and Julie to discuss the merits of adding Parkinson's to the medical exemption list and to discuss how we ensure that those with Parkinson's get the support that they need and deserve?
Minister.
I am happy to meet with my honourable friend and his constituent to discuss all of those matters that are of concern. I look forward to meeting with them as soon as the diary allows.
Shockat.
Thank you, Mr. Speaker. The eyes are not only the windows to the soul, but they're also a window to our health. Last week, I had the pleasure of meeting the team at Moorfields Eye Hospital, who, alongside UCL, have done some work where, through a simple retinal scan, can detect Parkinson's disease 7 years prior to any symptoms. Would the Minister agree with me that optometry, eye care and eye health should be at the forefront of NHS England's plan for integrated care and will bring forward a national eye health strategy? Thank you.
Minister.
Yes, absolutely. I'll be more than happy to support that. And this is all part and parcel of this government's aim to shift the NHS from hospital to community.
Munira Wilson.
Question number 2, Mr. Speaker.
Minister.
Thank you very much, Mr. Speaker. After 14 years of Tory neglect and incompetence, we inherited a broken NHS, and nowhere is that more apparent than on our mental health services. Too many people are waiting too long to access the care they need. To fix this, we will recruit 8,500 more mental health workers, provide access to specialist mental health professionals in every school, as called for by the Honourable Member, and we will also roll out Young Futures hubs in communities and modernise the Mental Health Act.
Munira Wilson.
Thank you very much, Mr. Speaker. With the Assisted Dying Bill being amended to include a panel which will involve psychiatrists who will determine whether a request for assisted dying should be granted, and as well as a number of cross-party amendments rightly calling for mental health professional involvement at an earlier stage in the process, what assessment have ministers made on whether there's sufficient capacity in the mental health care services, which he's just noted are so overstretched, to meet these demands and the potential knock-on impact on both waiting times and treatment for those with mental health conditions?
Minister.
The Honourable Lady will know that the government's position on the assisted dying bill is one of neutrality. I therefore simply am myself on the bill committee to speak in terms of the government's position around the workability and operationalisation of the bill. We look forward to seeing the amendment that's going to be brought forward by my honourable friend, the member for Spen Valley, and any comment or position we take will be based on the operationalisation of that amendment should it become part of the bill and ultimately should the bill gain royal assent.
Jane Craft.
Thank you, Mr. Speaker. Thurrock Community Hospital in my constituency does fantastic work in integrated care, particularly in integrated mental health care. What makes them successful, they said in the visit, is a commitment to working across ICBs, the local authority and other relevant partners in the community, as well as a commitment to meeting people where they are at, finding out what's important to them and working from there. How does the Minister see this kind of model as being integral to the reform of mental health care in this country? And will he join me on a visit to Thurrock Community Hospital to see what they do and what can be learned from how they act there?
Well, I thank my honourable friend for that question, and she is a doughty campaigner for this issue in her constituency. She's absolutely right that the integration of services is absolutely crucial in terms of ensuring that we get the best possible outcomes for people who are struggling with their mental health. And I, of course, would be very happy to discuss with her the possibility of me coming to visit her constituency.
Sure,
Thank you, Mr. Speaker. Is the Minister aware of the brilliant work done by Merseycare in reducing inpatient mental health suicides to zero? It's an extraordinary achievement, and under a former health secretary who may be standing not a million miles away from where I am now, that actually became an objective for all mental health inpatient units across the NHS. Would he look into whether that objective still stands, and if not, whether it could be reinstated?
Minister.
I thank the right honourable gentleman for that question, and I'm not familiar with the detail of the case that he mentions, but it does sound like a very positive and interesting development. I'd be happy to look into that further. The government is, of course, committed to delivering the cross-sector suicide prevention strategy for England, published in 2023, and the 8,500 new mental health workers we will recruit will be specially trained to support people at risk.
Drew Cooper.
Thank you, Mr. Speaker. I'm regularly contacted by constituents who are concerned that their children are not receiving the mental health care they need. Having met GPs in Winsford, there are clear concerns that access to CAMS is being rationed to the point that this has become almost inaccessible to all but the most severe cases. Can my honourable friend tell me what progress has been made towards our commitment to provide specialist mental health professionals in schools, ensuring there is early intervention that prevents issues from escalating?
Minister.
I thank my honourable friend for that question, and after the disastrous 14 years that we've had, we are, of course, facing a very serious situation in terms of mental health provision, and it's going to take some time to get the workforce in place, but we have a very clear commitment to having a specialist in every school. The appointment and training of those specialists is going to take some time. We are also, of course, rolling out open access Young Futures hubs in every community, and I'm confident that the combination of those two interventions will get us back into a situation where we can have, once again, mental health services that this country can be truly proud of.
Chair of the Select Committee, Layla Moran.
Thank you, Mr. Speaker. May I start by welcoming the new Minister to her place. I look forward to working with her, as I do other ministers. And as the Minister knows, 20% of the burden to the NHS is due to mental health, yet only 10% of the budget is allocated towards it. The Mental Health Investment Standard has been a very welcome maintenance under this government. However, we heard from Amanda Pritchard that it's only guaranteed for the next 2 years when she came in front of the committee the other day. Would the Minister agree with me that it has had a positive effect on mental health community services, and would he commit to protecting it?
Minister.
I thank the chair of the committee for that question, and she will have seen that we have made an explicit commitment to the Mental Health Investment Standard. We absolutely are committed to that, but I think in addition to that, we've got to drive reform in the system so that it's not just about the amount of investment that's going into the system, it's how do we ensure that it is working properly. And I'm absolutely confident that the commitment to 8,500 new specialists, Young Futures hubs and a mental health specialist in every school will facilitate delivery of services in a far more effective way than is currently the case.
Chris Vance.
Thank you, Mr. Speaker, and can I thank the Minister for his continued commitment to support mental health in this country. Would he also recognise, though, that mental health also involves supporting NHS frontline staff? I had the wonderful opportunity of spending time with the East of England ambulance service on Saturday morning. They do incredibly long hours and work incredibly hard, and obviously we need to think about their mental health as well.
Minister.
Well, I absolutely thank him for that, and we in this chamber should, whenever we possibly can, pay tribute to the services of people on the front line who every day are working heroically in very difficult circumstances. He's absolutely right around the pressures on the workforce. We are very conscious of that. We're going to be bringing forward a workforce plan in the summer, and we are also working at pace on recruiting the 8,500 mental health workers.
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr. Speaker. Last week, the Secretary of State issued a new mandate for the NHS in which a number of mental health targets were dropped. Now, I accept that targets which drive perverse behaviours should be dropped and that some sharpened focus is necessary. But mental health waiting lists are at a record high. Huge numbers of people aren't at work because of poor mental health, and our young people are being let down badly by CAMHS, not least in my constituency of North Shropshire. So will the Secretary of State accept that mental health targets should be reinstated and mental health treated with an equal priority to physical health?
I thank the Honourable Lady for that question. What we know about targets is that if you try and overload a system with too many targets, it causes confusion and you end up with, as she rightly says, perverse outcomes. And so we're very clear that we want to not have a system which is based on just making policy by press release, as was the case under the previous government, putting out press announcements, loads of more targets. It all makes for nice front-page headlines, but it doesn't actually lead to any serious delivery of the strategy that we need to deliver. So I'm with her on the point about focus. We are absolutely committed to mental health, as is set out in the planning guidance. It is one of the priorities in the planning guidance, and we will continue to deliver to that priority.
Monica Harding.
Question 3, Mr. Speaker.
Thank you, Mr. Speaker. UK leadership on global health is critical to safeguarding our national and international health security, building resilience and creating prosperity. I work closely with my counterparts across government. I met the Foreign Secretary very recently to discuss these issues, and the Minister for Development has them high on her agenda too. The UK has one of the largest vaccination programmes in the world, and our confidence and uptake rates are among the highest globally.
Monica Harding.
Thank you, Mr. Speaker. The NHS and we in the UK reap the benefits of our work in global health. Gavi is one of the UK's greatest success stories. It has inoculated 1 billion children worldwide, but it has also strengthened our health security, keeping us safe from diseases like Mpox and Ebola. So what leadership will he and his department take to strengthen support for organisations like Gavi to keep us safe here in the UK?
Secretary of State.
The Honourable Member raised an important point, and I know that my ministerial colleagues in the Foreign, Commonwealth and Development Office are looking at the investment cases for Gavi and the Global Fund as part of the spending review. I will make sure that her representations this morning are relayed to the FCDO, and she's very welcome to make those points in oral questions to that department too.
And the Minister, Dr Caroline Johnson.
Thank you, Mr. Speaker. Mr. Speaker, there were almost 67,000 cases of serious antimicrobial resistant infections in 2023 in the United Kingdom. War is increasing such infections globally, with 80% of patients in one Kyiv hospital in Ukraine said to have such infections. The Conservative government has a plan to tackle it. Does the Labour government plan to follow that plan? Is it on track to meet those targets? And if not, what is he going to do about it?
Mr. Speaker, I'm delighted that Dame Sally Davis continues her work on antimicrobial resistance. It is an absolutely critical issue. I pay tribute to the work that was done by the previous government in this area, particularly by Minister Quince. And of course, I think it's in the national interest that we maintain not just the national but international focus on antimicrobial resistance. That's why UK leadership in those global fora are so important, and we will continue to make sure they are a priority.
Dr Caroline Johnson.
Thank you, Mr. Speaker. Another area or at a time when it's important to work together is during a pandemic, such as by sharing research and other ways. Unfortunately, recent history tells us that when Labour negotiates, Britain loses out. So can he confirm that whatever emerges from the discussions with the WHO, he will not reduce the UK's capacity to take decisions in the interests of the British people?
Can I just say how regrettable it is that a sensible minister is sent along to parrot the absurd lines of her leader?
Question number 4, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. As I'm sure the honourable member knows, Hinchinbrook is in wave 1 of the new hospital programme, and his constituents can now look forward to a new hospital under this Labour government. The hospital has received over £44 million to deliver RAC mitigation safety works, and my right honourable friend, the Secretary of State, has commissioned a site-by-site survey of RAC hospitals, which will ensure individual development plans address the highest risk elements as soon as possible.
Thank you, Mr Speaker. Last July, Deborah Lee, the Senior Responsible Officer for the Hinchinbrook Hospital Redevelopment Programme, stated that the deadline for the new hospital was 2030. In a written answer to me in September last year, the Minister of State for Secondary Care confirmed to me that even following the mitigation measures of fail-safe steelwork, the remaining RAC buildings would only have a lifespan until approximately 2030. Can the Secretary of State confirm that the rebuild and all waves of the new hospital programme will not be delayed by the review of building safety regulations guidance announced by the Deputy Prime Minister in December? And can the Secretary of State also assure my constituents that the RAC buildings at Hinchinbrook will be safe to use beyond 2030, and if so, publish the risk assessment he has conducted that confirms this?
Minister.
I thank him. He has outlined the shocking state of some of these hospitals, and I can confirm again that we want a site-by-site report of these hospitals for exactly that purpose, to make sure that they are safe and understand any critical issues coming forward before these schemes go forward, and we expect that report during the summer.
Joyce Fenton-Glenn.
Thank you, Mr Speaker. Given that the Honourable Member for Huntingdon's Tory predecessor failed to mention RAC once and only mentioned Hinchinbrook Hospital 5 times in 23 years, does the Minister agree with me that what the people of Huntingdon and across the rest of the country need is a Labour government which is committed to rebuilding the NHS, not a Tory government that only pays lip service and fails to back it up?
Minister.
I commend my honourable friend for his research into the previous government, and indeed for the hard work that he is doing on behalf of his constituents. We are committed to the rebuild of Hinchinbrook. We have put the new hospital programme on a sustained footing, and that's something that his constituents can look forward to.
Ella Jones.
Question number 5, please, Mr Speaker.
Thank you, Mr Speaker. This government inherited a waiting list with a staggering 7.6 million people on it. Since July, that has already been reduced by almost 145,000. And ensuring the NHS once again meets the 18-week standard for elective treatment is at the heart of the government's plan for change. Our elective reform plan sets out how we'll meet this standard by the end of this Parliament through a combination of investment and reform that Labour knows from past experience delivers results.
Jones.
Thank you, Mr Speaker. I get regular messages from constituents facing terrible waits for care with potentially serious consequences. A 1-year delay for an early dementia referral, an 18-month delay for a cardiology review. Now, while I understand the case for short-term one-off use or spare private capacity to tackle the backlog while the NHS is rebuilt, can the Secretary of State please outline his longer-term thinking regarding privatisation of the National Health Service, in particular why he is encouraging the development of long-term relationships with the private sector?
Secretary of State.
Mr Speaker, the NHS has always worked constructively with the independent sector, and I don't believe that ideological hobby horses should come before getting patients faster access to care. Of course, this government is investing in our NHS, and before she complains about that, I would just point out the Green Party manifesto on the NHS said it would require an additional annual expenditure of £8 billion in the first full year of this Parliament, rising to £28 billion later. The Chancellor has just delivered a budget that delivers £26 billion of additional investment, and the Greens complain about it.
Deirdre Costigan.
Thank you, Mr Speaker, and I welcome the new Minister to her place. Hundreds of my constituents in Ealing Southall are sat on waiting lists for knee and hip operations. And while the member for North Hertfordshire says that she would like to see those waiting lists reduced, her party, the Green Party, has done everything they can to oppose Labour's plan for change. They've opposed our budget with a record investment in the NHS and opposed our agreement with the independent sector to bring down the backlog. Will the Minister agree with me that it's time for the opposition parties to stop wishing for a reduction in waiting lists and start backing Labour's credible plan to make a real difference?
I wholeheartedly agree with my honourable friend, and as we know from the Greens' experience in local government, they can't clear the bins, let alone the waiting lists.
Shadow Minister Dr Luca.
The Labour government's elective reform plan said there are plans for 10 straight-to-test pathways. Could the Minister name them or give one example?
It's absolutely ridiculous, Mr Speaker. They turn up carping and criticising about this government's elective reform plan. I just remind the honourable gentleman that when his party was in office, they delivered the longest waiting list in the history of the NHS. So if he wants to do a pop quiz, he can use Google.
Dr. Luke Evans.
This is the Secretary of State's own plan, Mr. Speaker. There was one example in the plan, but as the BMJ article from the 17th of January hopefully pointed out, the one example featuring Sarah, who had sinus pain and hearing issues, was quietly removed from all online and future drafts after, quote, a flurry of GPs pointed out her treatment was wholly inappropriate. It goes on, I quote, Sarah can pick up her dose of unnecessary radiation along with her weekly shop. The BMJ conclude on this part of their plan, Sarah's story is one of over-investigation, fragmented and inappropriate care, spurious choice and a lack of senior decision-making at first presentation. Activity for the sake of activity has little to do with high-quality care. Does the Secretary of State agree with the BMJ? If not, why not?
Mr. Speaker, I always believe in holding our hands up when mistakes are made. I'm happy to say the reason that case study was removed from the published elective reform plan is because it was a genuine mistake. I accept responsibility for that as the Secretary of State. Now, maybe the party opposite might like to accept responsibility for the highest waiting list, the lowest patient satisfaction in history, and finally have the decency to apologise to the country for the mess they left us in.
James Dish.
Question 6, please, Mr. Speaker.
Minister.
Mr. Speaker, with your permission, sir, I'd like to take questions 6, 7 and 20 together. Hospices provide vital care and support for patients and their families at the most difficult time. I'm very proud that this government has provided a £100 million capital funding boost for adult and children's hospices over this year and next. We are currently finalising the delivery mechanism for this funding, and we're pleased that Hospice UK is standing ready to distribute the money to local hospices across England. As well as this, Mr. Speaker, we're providing £26 million revenue funding for children's hospices in England in 25-26.
James Ash.
Thank you, Mr. Speaker. While I wholeheartedly welcome the £100 million capital funding boost for hospices announced before Christmas, Nottinghamshire Hospices is a large community-based hospice serving my constituency, which provides care for family members in their own homes. 17 members of staff have recently been told that they are at risk of redundancy. Can the Minister please expand on how the government will support organisations like this to continue to deliver excellent care in the community?
Well, I thank my honourable friend for this important question, and I commend the work of hospices like Nottinghamshire Hospice in his constituency, which I know does a wonderful job for people in his area. The investment I referred to in my earlier answer will help hospices like Nottinghamshire Hospice to provide quality end-of-life care to patients and their families this year and next. It can be used to improve IT systems, make it easier for GPs and hospitals to share vital data on patients, and help to develop and improve outreach services to support people in their own homes when needed.
Thank you, Mr. Speaker. North London Hospice in my constituency has a site in Winchmore Hill, which receives 1/3 of its funding from the NHS, with the rest coming from the generosity of the public. Many of their services, such as outpatients and wellbeing, are funded entirely by donations. While they welcomed the announcement of £100 million in funding, what assurances can the government provide about long-term hospice funding, given the significant delays in accessing funding from the integrated care boards this year? Hospices are anxious to set clarity on allocation and distribution of this funding.
I thank my honourable friend for that question, and in terms of her point about long-term funding, I did chair a round table last week with key stakeholders from the sector, and we were absolutely focused on developing a plan to secure the long-term sustainability of the sector. We cannot go back to the situation of the cliff edge that we had over the last few months, primarily due to the utterly chaotic and shambolic way in which the party opposite managed our system in the past.
Thank you, Mr. Speaker. I've had the privilege of witnessing at first hand the exceptional work of my local hospices, Forget-Me-Not Children's Hospice and the Kirkwood. But as other members have stated, they are also struggling with long-term funding pressures, and they've had to make the difficult decision to reduce services and staff. Can I ask what further work the government is doing to ensure that hospices thrive and ensure that end-of-life care is included in the 10-year NHS plan?
I thank my honourable friend for that question. One of the 3 shifts that the 10-year plan will deliver is around shifting more healthcare out of hospitals and into the community. And in the context of the plan, we're having discussions about the long-term sustainability of the palliative and end-of-life care sector, including hospices. As we develop the plan, we'll carefully be considering policies in this area with input from the public, patients, health staff and our stakeholders. As I mentioned earlier in response to my honourable friend, I was last week pleased to chair a roundtable to discuss long-term strategies for hospices to get the palliative and end-of-life care, including hospices, onto a more sustainable footing after 14 years of Tory neglect and incompetence.
Peter Bedford.
Thank you, Mr. Speaker. Leicestershire is home to some superb hospices such as Rainbows and Loros, both of which are set to be massively impacted by the hike in national insurance contributions. Given the important work that these hospices do, particularly for people at the end of their lives, will the Minister urge the Chancellor to reverse this pernicious tax rise?
Minister.
I'm once again struck by the fact that the party opposite seemed to welcome the additional investment that the Chancellor put into our health and care service, but they don't seem to have any plan or proposals at all for how the revenue should be generated for that funding. So until we get an answer to that question, Mr. Speaker, I think we're going to struggle to get much further in this House. But what I would note is that Toby Porter, the CEO of Hospice UK, said that the funding will allow hospices to continue to reach hundreds of thousands of people every year with high-quality, compassionate care. We look forward to working with the government to make sure everyone approaching the end of life gets the care and support they need.
Stephen Gattins.
Can I first of all pay tribute to those who work in hospices, who I think we can all agree do an astonishing job. The Minister will agree that the national insurance hike has had an impact on those who work in hospices. So can he assure me that when it comes to the Scottish Government's funding, and I acknowledge the 14 years of Tory misrule and the funding settlements that were handed down, that any Barnett consequentials in full will be passed on to the devolved administrations?
Minister.
Well, I thank the honourable member for that question. We've seen the biggest settlement in many, many years for our health and care system across the country. It is now up to the SNP government in Edinburgh to absorb that funding and to deliver it in a way that is actually going to improve services in Scotland, which is something we have not seen for a very long time under the misrule of the Scottish National Party.
Gregory Campbell.
Mr. Speaker, the magnificent work that is done by those who work in hospices, including the 4 in Northern Ireland, needs to be reflected in the funding formula. Would he undertake to discuss with ministerial colleagues the need for the Treasury to review that funding formula, particularly in relation to devolved settlements?
Minister.
I thank the honourable member, and absolutely, in the roundtable discussions and in subsequent discussions that we've been having with the sector, we absolutely do need to look at the long-term funding issue. We faced a cliff edge towards the end of last year. That's not the right way to do things. We've got to start getting the funding discussions moving now so that well in advance of the end of this financial year, we're in a much clearer position in terms of the funding position for the palliative and hospice sector.
Debbie Abrahams.
Number 7, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. Lord Darcy's report laid bare the shocking health inequalities in our country, and it is completely unacceptable that in Britain in 2025, maternal mortality rates for black women are more than double that of white women, or that for females in Blackpool, life expectancy at birth is 8 years less than in Kensington and Chelsea. Reducing inequalities in elective care was identified as a key priority in the planning guidance and mandate that the NHS published last month, and further measures to address these inequalities in our country will be at the heart of our 10-year health plan to be published in the spring.
Debbie Abraham.
Thank you, Mr. Speaker. In 2013, the then coalition government reduced the health inequalities weighting in the NHS formula, and that meant that less money went to deprived areas. This is despite there being evidence that between 2001 and 2011, for every £10 million invested in deprived areas resulted in 4 fewer men and 2 fewer women dying early. Will my honourable friend be able to reassure us on this side of the House that health inequalities weighting will be reinstated and that we can ensure deprived areas get the funding they need and that lives are saved.
Minister.
The government mandates to NHS England was published on the 30th January and makes the importance of tackling health inequalities really clear. NHS England has an existing programme that targets the most deprived 20% of the population with the aim of reducing health inequalities. And Mr Speaker, I can also reassure my honourable friend, who has been a determined campaigner on inequalities, that the health inequalities weighting has not been withdrawn. The funding in question, which amounted to £200 million, has been incorporated into the main ICB allocation, and the weighting of that health inequalities adjustment has been increased from 10% to 10.2%, so that the ICB still benefit from that extra investment, with funding redistributed to areas with the poorest health outcomes based on measures of avoidable mortality provided by the Office for National Statistics.
Thank you, Mr Speaker. May I welcome the Honourable Lady to her position. Mr Speaker, the Honourable Lady may be unaware of the number of debates I've led into women's health around endometriosis and pelvic mesh, and there is an inequality in the health service of how women are treated. So many women are deeply concerned about the announcements and the statements about how the concentration on women's health has been reduced. So may I ask the Minister whether she's spoken to well, she may not yet, but may I ask her to speak to the President of the Royal College of Obstetricians and Gynaecologists, and from that meeting would she speak to the Secretary of State, who quite rightly says that he recognises when mistakes have been made, to reconsider the approach to women's health that was made in the statement the other week. Minister.
Yeah. So the Darcy review highlighted there were too many targets set for NHS, which made it hard for local systems to prioritise those actions, and there has been no reduction in women's health services. This government is committed to prioritising women's health as we build an NHS that's fit for the future, and women's equality will be at the heart of our missions. We've got women's health hubs providing integrated women's health services in the community, and they have a key role in tackling inequalities faced by women. This department has invested £25 million over 2023 and 24 and 24-25 to support the establishment of at least one pilot women's health hub in every integrated care system.
Question number 9, Mr Speaker.
Thank you, Mr Speaker. Can I thank my honourable friend for his ongoing work in raising awareness in maternity services. We are committed to improving maternity care for women and babies. Evidence does not currently support screening for Vasa previa in the UK, but we have asked the Royal College of Obstetricians and Gynaecologists to review the guidance around this issue.
Thank you, Mr Speaker. My constituent, Kate Madison, suffered with Vasa previa in childbirth, and this is a condition which causes severe bleeding and can often result in the death of infants in childbirth and complications for the mother also. However, these risks are significantly reduced when identified during pregnancy. Now, thankfully, Kate's child survived, but she is campaigning to reduce unnecessary complications and deaths arising from this condition in the future. So will the Minister meet with me and Kate to discuss how we can tackle this important issue?
Minister.
I'm incredibly sorry to hear about his constituent Kate's experience. We want to make sure that women receive safe, personalised and compassionate maternity care, and that women with this condition are supported, which is why we've asked the College to look at the guidance. But of course I will be happy to meet with him and his constituent.
Smith. Sorry, Jim Shannon.
This is the other one, you know. Mr Speaker, can I thank the Minister very much for that response? And quite clearly there is a need to have the Vasa previa as part of the antenatal care. The Honourable Gentleman has set the scene very, very well. The Minister has responded in a good fashion. Can I just ask the Minister, is it possible, because it's also an issue in Northern Ireland, and the Honourable Gentleman is right to highlight it, that the Minister here shares what is going forward here with the representatives at the Northern Ireland Assembly? Thank you so much.
I thank him for that point. As he knows, I'm always keen to make sure we share good practice across the United Kingdom so that his constituents, like mine, can benefit from that, and obviously we'll work through the usual processes to make sure that happens.
Lisa Smart.
Question 10, please, Mr Speaker.
Minister. No, it's a very tough question.
Can I thank the Honourable Lady for her continued support, along with my friend, the Honourable Member for Stockport, for Stepping Hill Hospital. I know she's working hard on this issue. We are backing the NHS with over £4 billion of funding to the ICBs for capital priorities, with a dedicated £750 million estate safety fund next year to be addressing the poorest quality hospitals. I am pleased that the replacement of Stepping Hill's outpatient facility is already underway, backed by £11.5 million this year, and I look forward to visiting as soon as my diary allows.
Mr. Smart.
Thank you very much, Mr. Speaker. I'm grateful to the Minister for her response and our ongoing correspondence on this issue. I very much look forward to meeting her on site at Stepping Hill so that she can see for herself the reported £134 million repairs backlog at the site. In the most recent board papers, the significant risk backlog was mentioned at £19.9 million, Mr. Speaker, which is obviously having a detrimental effect on the hospital team's ability to see and treat patients. What hope can the Minister give that there is a plan for the funding of buildings at Stepping Hill so that my constituents get the treatment they deserve?
Minister.
I thank her for that, and she outlines for her constituents what many people across this House will recognise the capital state has been left in under the last government. In the autumn budget, we committed over £13 billion capital into next year, £4 billion to ICBs to start prioritising some of this work. We've allocated £1 billion for critical backlogs, maintenance and upgrades. A longer-term capital plan will follow the 10-year plan that we are currently developing to offer that hope that she asked for her constituents.
Charlotte Kenny.
Thank you, Mr. Speaker. Question number 11, please.
Thank you, sir. We know children and young people with special educational needs are waiting too long for the NHS services they need, in large part because local authorities have been hollowed out by 14 years of austerity. We are supporting earlier intervention through the Partnerships for Inclusion of Neurodiversity in Schools programme, known as PINS, backed by £13 million of funding. And NHS England has also launched a task force looking at how support can be improved for people with ADHD. We look forward to its report later this year.
I thank the Minister for his answer. Cambridgeshire has some of the lowest funding in England for GP practices and schools. Given the government focus on growth for the area and the record levels of need for SEND and young people's mental health services, will the Minister work with colleagues across government to make sure high growth areas don't suffer lower than average funding as we do now?
Minister.
Well, I thank the honourable member for that question, and it's absolutely clear that our commitment to improving the conditions for SEND is universal. I mean, we are looking at this from the point of view of improving provision right across the country. I'm very pleased that the PINS programme is making progress, and I would also draw her attention to the Early Language Support for Every Child, LSEC Pathfinder, where we've got a number of 9 Pathfinder sites over 2 years to provide early identification, targeted and universal support for children with speech, language and communication needs in early years and primary school settings, and working very closely with colleagues across DFE and the NHS England on that.
Mr. Strathern.
Mr. Speaker, while it's absolutely true that local authority resources are a big driver of some of the challenges in the SEND system, it's also clear to anyone working in it that a systemic under-prioritisation of children's health, all too often by local NHS trusts, is a big contributing factor too. And young people right across my constituency, waiting for assessments and lacking support, are paying the price. As part of our 10-year plan to reform the NHS, how will we make sure children's health is front and centre again, including much more support for people with additional needs?
Minister.
I thank him for that question. I'm working very closely with colleagues in the DFE at how we mainstream SEND provision more effectively, get more rapid EHCP, more rapid autism diagnosis, and a whole range of other issues that require really strong cross-party working. I'd be happy to brief him on that separately.
Joe Robertson.
Number 12, please, Mr. Speaker.
So stay.
Thank you, Mr. Speaker. The dementia diagnosis rate target was not met for the last 5 years under the Conservatives, and it declined over the course of the last Parliament. This government is committed to making sure that at least 2/3 of people living with dementia receive a diagnosis, and the government is investing in dementia research across all areas, from causes, diagnosis and prevention to treatment, care and support to help people live with this condition.
Joe Roberts.
People living with dementia number nearly 1 million. It's the biggest cause of death in the country today, and by the end of the 2030s is set to rise to 1.4 million. An early diagnosis is one of the best things we can do to support people living with dementia. Can the Secretary of State please explain, therefore, why dementia no longer features in NHS England's priorities, as published 2 weeks ago, and why the dementia diagnosis target is no longer included in that document? And will he commit to reinstating both dementia and the commitment to a diagnosis target in NHS England's priority guidelines?
Well, Mr. Speaker, I just restated the government's commitment to making sure that at least 2/3 of people living with dementia receive a diagnosis, and our investment and reform agenda will speed up diagnostics across the board. Under the last government, NHS planning guidance was a wish list of fantasy targets, most of which were never met. As the NHS got worse and worse, they piled on more and more targets to make themselves look busy. This government is ending the micromanagement, turning our NHS around and clearing up their mess.
Jonathan Black.
Mr. Speaker, my dad was a GP in Hartlepool for over 30 years. Indeed, the Secretary of State was very kind enough to meet him the last time he was in Hartlepool. He also has Alzheimer's, and I know that every day I think about why we didn't spot the signs early enough to get him the treatment he needed at an earlier stage. The Alzheimer's Society estimates that only 29% of social care workers have any form of dementia training. Does the Secretary of State agree with me that it's critical that we up that number and ensure that all social care workers have dementia training to ensure early diagnosis?
I'm grateful to my honourable friend for his question. I know how personal this issue is for him. I was delighted to meet his father on my visit to Hartlepool, and I obviously wish him very well. Mr. Speaker, I take very seriously what my honourable friend has said about the importance of workforce training. He mentions health and social care staff, which is of course important, but it also applies more broadly, I would argue, right across our society. On September the 6th, the Department launched the Adult Social Care Learning and Development Support Scheme, which allows eligible employers to claim for funding for certain training courses and qualifications, including relevant dementia training, on behalf of eligible care staff, and will continue to keep this under observation and review.
Question number 13, Mr. Speaker.
Thank you, Mr. Speaker. I know this issue is close to my honourable friends after his years of service nursing in the health service. We have to make sure that NHS is an attractive place to work for nurses and that they can progress. We're hearing directly from staff through our 10-year plan, and we work closely with the RCN unions and other trade unions through our social partnership forum.
Thank you, Mr. Speaker. I must disclose that I worked in the NHS for the last 22 years as a mental health nurse, and I progressed throughout my career from a nurse to a head of nursing. Recruitment and retention of nursing staff across the health and social care sector is key to delivering an NHS that is fit for the future. But the most recent NHS staff workforce survey showed that just 56% of NHS staff felt the health service acted fairly when it came to career progression. So what steps will this government be taking to address this and ensure that we have a nursing workforce that feels valued and a sense of purpose in the vital work they do?
Well, he's absolutely right that it's both key and the results are really worrying. And I know how proud my friends and family members were becoming nurses and what a great career nursing offered them. We have to deliver on that promise of a good career and that pride in being a nurse. We absolutely recognise we cannot rebuild the NHS without their skills, their high quality and critical compassionate care that they practice, and that's what we will do.
Rosie Duffield.
Thank you, Mr. Speaker. Does the Minister believe that the NHS should expect biologically female nursing staff to get changed in front of their biologically male colleagues if they identify as being female?
No.
Robbie Swan.
Question number 14, Mr. Speaker.
Thank you, Mr Speaker. I was delighted to work closely with the honourable member when he was Minister for Health for Northern Ireland. I'm delighted to work with his successor. I've met regularly with counterparts in Northern Ireland, Scotland and Wales since I took up office. The Chancellor's recent budget meant a massive £26 billion a year boost for the health and social care services. And of course, thanks to Barnett consequentials, that means that devolved administrations will benefit from a major increase in their budgets, the biggest since devolution began.
Thank you very much, Mr Speaker, and I thank the Secretary of State for his answer. Just over a year ago, the former Health Secretary wrote to counterparts in devolved administrations, actually offering to take patients from Wales and Scotland who had lengthy waits, giving them the option to choose treatment by providers in England. At that stage, it was declined as it was seen as a political stunt. Would the Secretary of State consider reviewing that offer, but this time including Northern Ireland, so that his call for the best of the NHS being offered to the rest of the NHS could actually be shared across the entire nation?
Thank you, Mr Speaker. I'm absolutely committed to working across the whole of the United Kingdom of Great Britain and Northern Ireland on cross-border working and cooperation where we can. I've had constructive relationship, particularly with my counterpart in Wales, to that effect. I'd be delighted to work with my counterpart in Northern Ireland in that same spirit. And whatever our differing views on the future of the United Kingdom, I've had equally constructive discussions with my counterpart in Scotland as well. They may not thank me for mentioning it.
Let's go to topicals with Brian Lewisham.
Topical number 1, please, Mr Speaker.
State.
Thank you, Mr Speaker. Yesterday we kicked off National HIV Testing Week. Getting tested for HIV is quick, free and confidential, and I'd like to pay tribute to the leadership of my right honourable friend, the Prime Minister, for becoming the first in history to take an HIV test, the first leader in the history of the G7 to take an HIV test. As a former member of the Independent HIV Commission, I'm determined that this government will deliver our commitment to end new transmissions of HIV in England by 2030, and we'll set this out shortly in our new action plan, which will be developed by myself and my brilliant new Minister, my honourable friend, the member for West Lancashire.
Thank you very much, Mr Speaker. 14 years of austerity has created a new strata of society, that of the inward poor. And recent talk of ruthless cuts to social security is beyond alarming. So, does the Secretary of State agree that having a welfare system that covers the cost of essentials as proposed by the Trussell Trust and the Joseph Rowntree Foundation would alleviate hunger and hardship and therefore relieve a considerable strain on the NHS?
Thank you, Mr Speaker. Mr Speaker, I'm the product of the welfare state, and I remember the benefit system putting food in the fridge and money in the electric meter. And I also know from lived experience that people who are trapped in the benefit system want to escape, and the best way out of poverty isn't through social security, important though that is. It is through fair, decent work that pays, and that's this government's agenda.
Just remember, we are on topicals, folks. Shadow Secretary of State Adegar.
Thank you, Mr Speaker, and can I congratulate the Honourable Lady, the member for West Lancashire, on her promotion to the front bench. Mr Speaker, eating disorders affect over 1.25 million people in our country, and these oral questions are the last before Eating Disorder Awareness Week starts later this month. Now, the Secretary of State will be aware of the amazing work done by the eating disorder charity BEAT, who I met a few months ago and paid tribute to. So, does he intend to commit to backing BEAT's calls for the rollout of access to intensive community and day treatments for eating disorders more broadly, rather than the limited number of places currently, and a timetable to deliver it?
Mr Speaker, I really welcome the Shadow Secretary of State raising this important issue. We know that too often, even when patients with eating disorders are in health settings, they're not receiving the right care, the right support at the right time, and I'd be delighted to receive representations from BEAT to see how we improve this situation.
There you go.
Thank you very much. I'm grateful to the Secretary of State for that answer. Now, he will know osteoporosis impacts 3 million people in our country. He is aware of the campaign by the Royal Osteoporosis Society and the powerful parallel campaign led by the Mail on Sunday and Mail for the rollout of access to fracture liaison services across the country. Now, pre-election, the Secretary of State committed his support to this and to a rollout plan. Now, people will look for an answer that looks to the future, not the past. So when will he publish that fracture liaison services rollout plan to ensure all who need to access these vital services can?
And will he work with campaigners and me to achieve that rollout faster than 2030?
Thank you, Mr. Speaker. This is unusually consensual today because this government is committed to the rolling out of fracture liaison services across every part of the country by 2030. I promised this before the election, and that is what delivering. In fact, we've already started by investing in 14 high-tech DEXA scanners, which are expected to provide an extra 29,000 scans to ensure people with bone conditions get diagnosed earlier. I notice he doesn't want to look to the past. I'm not surprised given their record, but I'm sure we can work together in the future.
Joe Morris.
Thank you, Mr. Speaker. For villages such as Slaggyford, Kirkhoff and Mohope in my constituency, the Cottage Hospital in Alston is closer than the nearest hospital in Hexham. As my constituent Roland has outlined to me, despite this proximity, ambulance services find themselves restricted by county borders. Rural constituent access to healthcare and prompt rapid response services is suffering as a result. So would the Minister meet with me to discuss ambulance services in rural areas?
Minister.
I was able to holiday in his constituency this summer, so I do understand some of the rural challenges. Very beautiful part of the world. It's a matter for local ICBs how they organise ambulance services. We know there are many problems we want to resolve, and of course I'll be very happy to meet with him.
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr. Speaker, and I also welcome the new Minister to her place. This morning's oral health survey revealed that more than 1 in 5 5-year-olds in England have experienced dental decay, affecting their ability to smile, socialise, as well as causing pain and distress. So will the Secretary of State guarantee the government's commitment to tackle this problem, and also back Lib Dem calls for an emergency scheme that guarantees dental check-ups for children?
Mr. Speaker, this is an issue that the government is prioritising. The honourable member will be aware of the commitment made to 700,000 urgent dentistry appointments. We are ramping up to deliver that commitment, as well as supervised toothbrushing our schools. Of course, further and wider-ranging reform is needed, which is why I'm working close with my honourable friend, the Minister for Care, to make sure that we rebuild NHS dentistry from the rot left in it by the Conservatives.
Matthew Patrick.
Thank you, Mr. Speaker. As my right honourable friend said, this week is National HIV Testing Week. In the Liverpool City region, Steve Rotherham is forming plans to end new HIV cases by 2030. The Royal Liverpool is starting opt-out testing, and as my right honourable friend said, our Prime Minister became the first leader, I think, in the G20 to take an HIV test this week. Could he please set out his plans to ensure we have more HIV testing going beyond this important week?
Minister.
I thank my honourable friend for that question, because increasing HIV testing is a vital step towards meeting our goal and will be a core element of our new HIV action plan, which will be published later this year. It's why we are investing over £4.5 million to deliver a national prevention programme, and it's why today I can announce that we will extend the programme to a further year to March 2026, backed by an extra £1.5 million, Mr. Speaker.
Thank you very much, Mr. Speaker. The charity Darker Side of Pink estimates that 31 women lose their battle against metastatic breast cancer every day, which means that more than 20,000 have died since I first raised this at PMQs 2 years ago. So can the ministers tell us what this government is going to do to raise awareness, understanding, availability of drugs and screening for women facing this challenge?
The honourable member is quite right to raise this serious and important issue. We want to make sure that we improve diagnostics, access to treatment and research in this area. I can think of no better person to lead the work in this area on the National Cancer Strategy than my honourable friend, the Minister, who has lived experience and demonstrates that people can live well with cancer.
Lee Pitcher.
Thank you, Mr. Speaker. Women across the country, including my constituent Lisa from Hacksea, are in a position where they are struggling to access vital HRT medications such as Estradot patches. Due to a 30-year-long medical condition, Lisa has had her ovaries removed and now faces severe health consequences because of these ongoing medical shortages, with no resolution expected soon. Given the repeated supply issues with HRT over the recent years, what specific actions is the Minister taking to ensure consistent and reliable supply of these essential medicines?
I absolutely appreciate the frustration and distress that medicine supply does cause. We are working intensively with industry to resolve HRT supply issues. Estradot supply issues are expected to resolve by the end of the month. We have issued a serious shortage protocol to allow the community pharmacists to supply alternative brands of the same medicine, and these remain available.
Gaga Mahindra.
Thank you, Mr Speaker. My constituent James from Abbots Langley wrote to me about the Chancellor's recent talk about pushing infrastructure projects such as the Heathrow Airport expansion. Why is the Health Secretary not pushing for this infrastructure spending to be spent on the new Watford General Hospital, which has cross-party support, is shovel-ready and will save lives?
Mr Speaker, if he was that committed to that particular project, perhaps he can explain why his government did so little about it.
Peter Lamb.
Since April, Crawley's Urgent Treatment Centre has been temporarily closed overnight due to low staffing levels. Could I ask the Secretary of State what they intend to do to ensure that communities like mine see services resume normality?
Minister.
We are absolutely committed to urgent treatment centres. They have a vital role in supporting patients, particularly through high demand. My understanding is that this is a temporary closing. They are looking at running a pilot, and I know that my honourable friend will be working closely with his ICB to make sure that it serves his constituency adequately.
There are 153,000 people living in the UK with Parkinson's. 1 in 37 will be diagnosed in their lifetime. 18,000 new cases every year, 4,200 in Northern Ireland. Would the Minister agree with me it's time we had a Parkinson's strategy, not just for England, but for Scotland, Wales and Northern Ireland? As I always say, let's do it better together.
Where have I heard that before, Mr Speaker? Of course, he knows I will agree with him on the matter of the Union, but I also agree we should work cross-border wherever we can, particularly in important issues like Parkinson's, where we've got to make better breakthroughs both on the research, the treatment and hopefully the cure.
Thank you, Mr Speaker. After 14 years of Conservative government, 77% of people in Derby can't access an NHS dentist. Can the Minister tell us what caused the rot to set in, and how do we fill the cavities in provision?
Well, I see what my honourable friend did there, and she should brace herself as we drill down into this answer. The party opposite is the cause of the rot setting in. Spending on NHS dentistry fell by a staggering 18% between 2010 and 2024, so it's little wonder that dentistry is on its knees. We will shortly set out plans to introduce supervised toothbrushing for 3 to 5-year-olds in the most deprived communities, and we're working with the dental sector to implement our rescue plan.
Sir John Lamont.
Thank you, Mr Speaker. New research from Marie Curie has found 85% of public expenditure on people in the final year of life in Scotland is spent in hospitals and only 14% on community care. The figures are very similar for that spent in England as well. So can the Minister set out what work is being done to ensure a minimum standard of community treatment for people in the final year of life?
I thank the honourable gentleman for that question. It's vitally important that we have a palliative and end-of-life care service that works and is on a sustainable footing. I have had discussions with the sector. We want to ensure that we don't have the cliff edge that we had at the end of last year, and he's absolutely right to point to this, and we will be reporting back in due course.
Sally James.
Thank you, Mr Speaker. The Minister is aware that the contract uplift for dentists is facing a near 11-month delay. So can the Minister confirm that the dentists will be receiving their uplift, and what will be done going forward to make sure that they receive enough money to cover the cost of NHS dentistry?
Minister.
I absolutely can reassure my honourable friend on that point. We implemented the contract uplift on the 29th of January. Dentists will therefore be receiving their uplifted payments in March, backdated to the 1st of April 2024. We've also increased payments for practices training a foundation dentist for the first time in more than a decade.
Sir John Whittingdale.
Thank you, Mr Speaker. In Malden, the number of patients per GP is already 50% above the number for England, and that's only going to increase with the amount of house building proposed. GPs are struggling to cope now with ever-increasing costs, and I have one practice still undertaking collective action, so-called. Will the government review the whole system of GP funding before it breaks down completely?
Minister.
I thank the honourable gentleman. We are in negotiations about the future contract with the GPCE of the BMA. Those negotiations are proceeding, and he's absolutely right to the fact that we need a serious reform. We will be pushing reforms through on that basis. To his point around the estate, we've got £102 million commitment on capital for the primary care estate, and I think that will go some way towards reassuring him.
Clive Lewis.
Speaker, can I thank the Minister and my honourable friend for all the support he's given the University of East Anglia set up its dental school. But he'll be aware that all those shiny new dentists coming out in a few years' time will be going into the private sector, not into the NHS, unless we can sort out the NHS dental contract. So can he give us any kind of idea or a timeline when we can expect to hear an announcement on that critical factor?
Minister.
I thank him for that question, and I really do wish him all the best with his efforts to get that dental school up and running. In terms of the need for serious reform, of course, there is no perfect payment system, but we've got to get a payment system in place that actually makes NHS dentistry attractive, and at least as attractive as doing work in the private sector. And we are working at pace on that, and I will report back on that as rapidly as possible.
Vicky Slade.
44,066 children, that's 1 in 6 children, are waiting more than a year for medical treatment compared to 1 in 100 adults. In community medicine, they're at their worst, and in Dorset, there are waits for up to 2 years in child development, and CAMS delays for a year are normal. 53% of all community health referrals are more than a year. So can the Minister confirm whether the 18-week target will apply to community referrals or not just hospitals? And if not, when can we expect a target so that children are not badly affected?
Can I thank the honourable member for her question? She's absolutely right to put the spotlight on paediatric health in the way that she has. Mental health being important for children and young people, but physical health too. This government is committed to dramatically reducing waiting lists, returning to the 18-week standard by the end of this Parliament, but we should go and aim to go even harder after those childhood waiting lists, because many children waiting in pain and agony are losing valuable years of their childhood they will never get back.
Thank
you, Mr. Speaker. Now, the Government knows how hard I have worked as co-chair of the all-party parliamentary group on medicinal cannabis under prescription. I am pleased to hear that there is a trial, but I would urge the Minister and her team to make sure that this trial actually goes ahead, because others haven't, because of Brexit, because of COVID, because of elections. Please, can she meet with me to ensure that I am kept up to date and the APPG is on the work of the NHS?
My honourable friend has been a strong campaigner on this issue on behalf of her constituents, so I congratulate her for that work. We are confident in this trial going forward. We've invested over £8.5 million in this randomised trial. I'm very happy to meet with her, and I urge people to come forward and support the trials. I think that's the way forward for this issue.
Anderson.
Thank you, Mr. Speaker. Now, the new Health Minister has stated that it's OK for a human being to present as a llama. So what I want to know is, if I have a family member who presents as a llama, suddenly becomes ill in the middle of the night, do they send for a doctor, a vet or a straitjacket?
Mr. Speaker, I can just say to the honourable member that my honourable friend, the Minister for Public Health, believes in treating every human being with the dignity and respect they deserve, even the honourable gentleman.
George McAllister.
Mr. Speaker, shortly after the election, the new government announced £4.3 million for a new community mental health hub in Whitehaven. Unfortunately, the local mental health trust followed that decision by announcing a closure of the Udale ward for acute mental health services. Does the Minister agree with me that we need to get early intervention right before we close acute services, and would he bring a meeting together to scrutinise that decision?
Minister.
I thank him for that question. Integrated care boards are responsible for providing mental health services to meet the needs of their local populations. As part of our plan for change, we will reduce delays and provide faster treatment. We're working with NHS England to transform mental health services, shift care from hospitals to local communities, and increase access to support for people across the country, including in rural areas.
Bobby Moore.
Mr. Speaker, insomnia affects many patients, including my constituents, who are being advised by their GPs to try cognitive behavioural therapy as an alternative to medication. However, access to digital CBT programmes are not available on the NHS, leaving many without access to drug-free treatment. So will the Minister outline what steps the government is taking to ensure patients have access to digital therapies so that more people can get access to evidence-based drug-free support?
Mr. Speaker, I think the honourable gentleman hit the nail on the head right at the end there, which is the importance of evidence-based treatment. But as part of the government's shift out of hospital into the community, from analogue to digital and from sickness to prevention, the NHS absolutely should be in this space, and we're considering those issues as we develop our 10-year plan for health.
Neil Francis.
Speaker, the NHS South East London Integrated Care Board provides services to my constituents in Bexleyheath and Crayford, and I've discussed on ways in which we could better deliver services by redeveloping the area of community hospital site in Northumberland-Heath. Will the Minister be able to provide an outline on the Government's plans to provide capital funding for expanding community services like those at Erith Hospital?
Minister.
I thank the honourable gentleman for that question. I would actually be delighted to meet with him so that we can get into a bit more detail about what's happening there. But he's absolutely right to point to the need for more and better community health services. That's going to be at the heart of our shift from hospital to community in the 10-year plan that we're delivering.
Steve Darling, final question.
Thank you, Mr. Speaker. Health authorities in Devon are set to trial the relocation of a vital coronary service from Torbay, 24 miles away, to Exeter. Will the Minister meet with myself and fellow South Devon MPs who have grave concerns about the impact on patient safety?
Mr. Speaker, it's important that people are able to get the right care in the right place at the right time, and I recognise the challenges, particularly in geographies like Devon and Cornwall, that have more rural and remote communities. In the first instance, I'd encourage him to take this up with local health leaders and his integrated care board, but ministers are always open to receiving representations beyond that if he needs further reassurance.
Let the front bench change it.